All right. Thank you, Brooke, for the kind introduction. I'd obviously like to thank MomsTEAM for hosting the summit and having us all here. And it has been a really great experience working with them since probably the late spring in really trying to identify what we can do to make smart teams in our communities and starting to bring this pilot program together. So I guess we probably want to first start out with what is a smart team and what makes a team smart. And a smart team, the way that we're defining it, is a youth sports organization, a youth sports league, and a youth sports team that really wants to implement best practices in youth sports safety. Not only for injury prevention, looking at the physical aspect, but psychological issues, preventing bullying, sexual assault, and other issues that plague youth sports. It's a team where parents and coaches want education. They want information, and they want to work to make their league better. They want to make changes to implement best practices that are identified from the best evidence in the medical literature, what we know can work and what we know can actually make change. So we've heard a little bit about why we need smart teams. Youth sports has never been under as much scrutiny as it is probably today. We look at things like the Little League World Series that's portrayed on national TV, on ESPN. Back when I was growing up, we really didn't have a lot of youth sports on TV. There wasn't the same emphasis, and you participated in a lot of different sports. We hear of stories of bullying and abuse at the youth sports level. We have issues with injuries, overuse injuries, and obviously concussion as a big injury. Young athletes have pressures from parents and coaches. They're usually chasing some elusive dream for a college scholarship or for participating in professional sports. There's a sense of competition that really runs down to the young ages. You've probably seen some of the YouTube videos out there that show these little Pop Warner kids just bearing into each other, which is really not what we want in trying to develop young athletes. Youth sports should be about motor development, about teamwork, about building self-esteem, and all of these things to really help them kind of set the stage for moving forward in life. Unfortunately, at the youth sports level, there's little oversight. Unlike colleges that have the NCAA and high schools that have the National Federation for State High Schools, there really are not specific youth sports governing bodies that could come in as an independent organization to really help foster the implementation of best practices, getting information to the coaches and parents who want it. And this is where MomsTEAM comes in with the SmartTeams pilot project. We know that there are injuries, and this has obviously been a concern for MomsTEAM, especially related to concussion. You're going to hear more about concussion specifically later, but that's just one of the issues that we're looking at to address with the SmartTeams pilot project. We know that the concussion legislation has been enacted in all 50 states and DC, and part of that is even what we're doing is just reinforcing what the state legislation says in the communities that we're participating and making sure that the coaches and the parents are aware of the restrictions regarding their state law. But it's not just concussion, it's overuse injuries as well. You've probably heard renowned orthopedic surgeon Dr. Andrews talk about this plethora of Tommy John surgeries that they're seeing in young athletes. Pitchers are pitching too much. We really shouldn't have this epidemic of these types of injuries in these younger kids. We know they're specializing too soon, which is also an issue, and setting themselves up for long-term pain and potentially disability. So this seems like a lot of negative things that goes on with youth sports, but I really want to hit on the positives and why we really believe in the SmartTeams pilot project. We really don't want to get to the stage, and I've heard people talk about it, well, we should just get rid of football. We should just have athletes stop pitching. And that's not really where we want to go, because we know that youth sports fosters good psychological, social, and physical development. We know that it helps with self-esteem, success in academics, and research out of our institution has shown that adolescent athletes have better health-related quality of life in multiple domains than their non-athlete peers. And so there's a lot of positives for participating in youth sports, which is why I think a lot of us are very passionate about this particular topic. The good news, as Dr. McDonald indicated, is that overuse injuries can be prevented. In fact, it's estimated that about 50% of all overuse injuries can be prevented through various steps, from things like instituting PPEs, for having coach training, for having athletes undergo some kind of strength and conditioning, and having appropriate medical supervision. Unfortunately, we often see at the youth sports level a lack of standard policies regarding individuals who are coaching. They're primarily parent volunteers who are doing this out of the goodness of their heart, but need some education and information to really help them be prepared to deal with what they need to deal with. Some of the coach studies that we've done have shown that youth sport coaches even lack knowledge in areas as simple as first aid, CPR, and basic sports injury management. Never mind the numerous studies that are out there that show lack of awareness and education for certain things specific to concussion or heat illness or hydration. So the SmartTeams pilot program really aims to provide comprehensive, practical information regarding best practices and education to youth coaches and parents. We really want to establish age and sport-specific best practices. What should leagues be doing? What are the considerations that they should have in order to have a safe sporting environment for all that are participating? And lastly, we want to be able to publicly recognize those teams and leagues that have gone above and beyond to become a smart team. Use them as models for other teams across the country as to how they can, with resources in their community, implement these best practices to ensure this safe environment. For SmartTeams to work, MomsTEAM is partnering with athletic training education programs across the country, where athletic training educators, scholars, and students are being involved with their community and instilling the SMART team. Currently, our pilot league locations are in Columbia, South Carolina, Chattanooga, Tennessee, Mesa, Arizona, Grand Prairie, Texas, Tulsa, Oklahoma, and East Lansing, Michigan. And you will meet my colleagues who are also participating in this, and they'll talk a little bit about how they're implementing the SmartTeams program into their community. MomsTEAM will serve as an independent organization overseeing these that will award the SmartTeams honor to those leagues that are worthy of it. What do we really want to do, and what are the things that we're trying to get at? The key areas that SmartTeams are going to focus on are having emergency action plans, written action plans so we know what to do in the case of those unfortunate events, practiced emergency action plans, having coaches trained in CPR and first aid so they can be on-site administrators, because we do know that there's a lack of on-site medical coverage, specifically athletic trainers at many of these sites. Having access to an AED when possible. We know with sudden cardiac death and other cardiac issues, being able to implement an AED and CPR early on is extremely important. Background screening of coaches and volunteers to make sure that we have individuals who should be coaching the kids around, and those who have issues in their past are not put into the type of environment where they are working with children. We want to educate on the signs and symptoms of concussion and ensure that each league has a proper concussion management plan that not only follows the state laws but also best practice associated with concussion management. Heat illness and hydration issues are extremely important, and ensuring that we have best practices like cool first and transport second in many of these leagues. We also want to be able to eventually get to the stage where we can implement prevention programs, preventative training programs for the shoulder, for the knee, and for other areas that will allow these younger kids to build their core strength and hopefully prevent injuries down the road. The recommendations that we will be following for the SmartTeams program are being vetted by the MomsTEAM Board of Directors as well as the Advisory Board, based off of published best practices from reputable medical organizations such as the National Athletic Trainers Association, the American Academy of Pediatrics, American Society for Orthopedic Sports Medicine, and others. So they are going to be well-vetted best practices that we will implement into these communities. So how does the SmartTeams project work? Well, each project coordinator is going to be working a little differently, and I think when the panel comes up, you'll hear how we're each trying to build the program in our communities. Every community is a little bit different, and one big thing we've learned this year is that we can't try to implement the same thing in a cookie-cutter fashion in all of these different leagues. Some leagues seem to have more of an interest in the concussion aspect. Others seem to have more of an interest in first aid and CPR for coaches. And so we're really working with the leagues and what they need based on the deficits that we're noting. We're starting out with an initial evaluation of what the coaches, parents, and athletes know about a lot of these sports safety issues. We've recently had IRB approval at all of the institutions and are completing a pre-intervention study in which we're surveying the coaches, the parents, and the athletes. We're going to then use that information as a baseline as we develop and implement the educational components. Part of the education are twice weekly newsletters that will be sent via email to all of the parents and coaches participating in the pilot program. These are little snippets of information that give them about 3 different topics in very easily digestible format that links back to the MomsTEAM site if they want more information. So we know that they'll be getting some of that information. Some of the leagues have also requested more formal educational opportunities where parents and coaches gather at a meeting to learn about a specific topic, and those will be implemented as those leagues want. Lastly, we're trying to get athletic training students out to some of the sites to just be there for the parents to begin to identify with what an athletic trainer is and what an athletic trainer does so that they have someone to ask questions to, someone to bounce ideas off and to help enforce that safe environment, which is why partnering with the athletic training education programs is a unique aspect of this particular project. So in conclusion, a SMART team is one that will have a written and practiced emergency action plan, require pre-participation examinations, ensure safe playing environments, have safe and appropriately fitted equipment, cool before transport in cases of heat illness, recognize signs and symptoms of concussion, recognize signs of overuse, understand what to eat and drink before and after activity, and have policies in place to prevent bullying, abuse, and other issues. Since this is a pilot year for this particular program, it is a bit of a work in progress. And I think as the panel comes up, we'll not only share some of the successes, but also some of the challenges in trying to implement this in each of our communities that we are hoping to learn from as we move forward into next year and a full rollout of the SmartTeams program across the country.